Good morning, good afternoon. Welcome to today's presentation, Achieving Equitable Vaccinations for Newcomer Families. Before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at CHIO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Colleen Drake. I am N4's Project Engagement Coordinator, and I will be hosting and moderating today's presentation with my colleague and co-host, Andrew Tomeyer, Education Coordinator, who will be monitoring the Q&A box today. I am now pleased to introduce you to today's presenter. I'm going to ask that you turn on your video as I introduce you. Cora Constantinescu is a pediatrician, infectious disease physician, and clinical associate professor in Calgary, Alberta. She holds a master's in medical education and specializes in development and study of antimicrobial stewardship education interventions rooted in behavioral change theory. She has applied these skills to battling antimicrobial resistance, promoting appropriate prescribing behavior, as well as combating vaccine hesitancy for healthcare workers and the public. I now welcome Dr. Constantinescu. I
Thanks,
just have
everyone.
Thank you, Cora. I just have a few housekeeping slides to go through and we'll be diving into the presentation. Today's session is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we will inform you with the details for an alternate makeup session. Before we begin today's event, I would like to take a moment to introduce you to the platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that sometimes many of you might have the same question or be interested in a particular response. Today, you have the option of upvoting a question. Please upvote questions you are interested in hearing the answer to, and we will prioritize those questions and pose those to our speaker first. N4 is pleased to announce that select webinars are now accredited, including today's. Members of the Royal College of Physicians and Surgeons of Canada, the Canadian College of Health Leaders, and the Canadian Psychological Association earn credits toward their maintenance of certification requirements by attending select N4 webinars. With that said, let's jump right into today's presentation, and I am very happy to pass the virtual podium over to our presenter for Cora to take it away. Thank you so much.
Good morning, everyone, and thank you so much, Colleen, for that introduction. Um, I will replace your share with my share, if that's okay.
Yes, of course.
And the most complicated part of the whole presentation is ensuring I'm showing you the right slide. Okay, hopefully you're seeing the right slide here. Thank you so much for joining us, and thank you especially just before the possible holiday break for some of you. I really appreciate this. Vaccine advocacy, especially in specialized groups, is very near and dear to my heart. So thank you for taking the time. I do want to share with you that I'm a co-investigator on a number of clinical trials that are sponsored by companies that make vaccines. And whereas I don't think this impacts today's presentation in any way, I do have a relationship with these companies and I want you to know about them. And I'll explain what that is. I am a co-investigator on a number of clinical trials. The money that comes in from the pharmaceutical companies goes to a university account, not directly to me. I've also done some presentations for the CCRN, which is a conference in the Federation of Canadian Women in Medicine, and I have received honoraria directly to me from those groups. And I've also done a lot of education work on webinars and um, uh, continuing medical education that had sponsoring from pharmaceutical companies. I have found a way to take that money and send it to a university account. It doesn't go directly to me, but this is a relationship that I am in with these companies. And I want you to know about that, that even though the money doesn't come to me, there is that relationship there. I will not really be speaking on. Uh, any of these any products that some of these are putting together, maybe with the one exception today, as we're not really speaking about specific products, but I again want you to know about that relationship. I am presenting to you from the Treaty 7 region, also known as Calgary, Alberta, and that includes our Blackfoot Confederacy, including the Siksika, Pagani, and Kainai First Nations. We also have the Tsuut'ina First Nation, the Stoney Nakoda, including the Chiniki, Bearspaw, and Wesley First Nations. And Calgary is also home to the Métis Nation of Alberta Region 3. Okay, so these are the objectives we're going to try to aim to get through today. So, we're going to explore accessibility barriers that exist for vaccination services among newcomer families. So, big disclosure is that most of my presentation is going to relate to pediatric vaccines or children vaccinations. However, I do believe that what we speak about and the general principles of this really do apply to adult vaccination that we know has a more and more important role in our population. I'm also hoping that you can gain knowledge and insight on some strategy development to reduce these barriers for newcomers. And to that end, I will share some of the work that we've done in Alberta and in Calgary that has been kind of like boots on the ground type of work to address some of these barriers. And then we're going to look at the work that can be done as healthcare professionals in our own practice when working with newcomer families. And that will be mostly around communication towards the end of the presentation. Newcomers to Canada are the biggest driver of population growth in our country. And they actually represent almost a quarter of the entire population. And Alberta, the province I'm from, is home to the third largest newcomer population in Canada. And Calgary, which is the city I live in, has actually had the largest influx of newcomers in the last few years. So this is a more and it's always been a relevant issue, but I will try to make the case to you why I think it's now more relevant than ever to think around protecting and how we can empower newcomers to have control of their health around immunization. Here's what's scary: newcomers have lower rates of routine immunizations compared to the general population. And those are unique barriers that they face. So you might have heard a lot about newcomers to Canada initially reported to be in better health compared to local born counterparts, that healthy immigrant effect that actually doesn't apply to conditions such as infectious diseases. And there is a clear vulnerability to this group when it comes to vaccine preventable diseases. And I was at the Canadian Immunization Conference at the end of November, and Dr. Shannon McDonald's group and specifically Crystal Dew were presenting that HPV uptake, so HPV vaccine uptake in immigrant adolescents was only 53%. Now, in Alberta, we do boast some of our lowest uptake of vaccines across board, when you look across Canada, but 53% is actually lower than most of our even lowest uptake pockets. So when you think about that, that one in two immigrant adolescents would not be protected against HPV, that's a very significant portion of our population. And what we've learned, and this certainly does not just apply to newcomers and to all groups, is that if we're going to look at an appropriate approach for driving vaccine uptake, it has to be tailored. In order to tailor something, you have to understand what is going on in that population. And this is why I think this is super relevant. is there is a very clear drop in coverage around routine childhood immunizations across the world. Um, when you look at the post-pandemic, the largest backslide in childhood immunization in over 3 decades happened. UNICEF estimated 67 million children missed out on a vaccination in that 3 year pandemic period, and 48 million didn't receive a single routine vaccine. This is known as zero dose. Now, a lot has been done to increase uptake, and we've suddenly narrowed this gap of post pandemic drop in coverage across Canada, but we're not where we were before. And then we also realized that not all of it was due to access or public health units being closed or diversion of resources. We now also know that there is a significant post pandemic drop in confidence. So again, UNICEF estimated that the importance of vaccines for Canadians, this is childhood vaccines, declined by 8.2 percentage points. And people under 35 were most likely to report less confidence about vaccines for children after the start of the pandemic. And those people under 35 are either current parents or will be parents of children. So not only do I think this is highly relevant right now when we think of our population, but I worry a bit about the next decade to 2 decades in terms of what this means for our community protection and what it means for those of us who work in hospitals in terms of seeing vaccine preventable diseases among our children. The case in point, when you look at our immunization rates, Alberta is very privileged that we actually have a vaccine registry. And we have available vaccination rates. So it's available on a dashboard. It's publicly available. You have to do very minimal statistics. And I certainly could generate this graph. But when you look, you will see there is a significant drop. I'm just giving you the examples of measles containing vaccine a significant drop in uptake over the years, over the last 14 years in 2021 and 2022. And that drop is also sustained in 2023, which I'll be able to have access to to those data pretty soon. And we're seeing the significant drop. So it's no surprise that we're also seeing a lot of return of vaccine preventable diseases. So you've heard a lot about the measles outbreak happening in Quebec, Ontario, now most recently in New Brunswick, including a child who died in Ontario of measles. And this is the first death in decades. And when I looked at the data from Public Health Ontario, in the decade between 2013 and 2023, there were 100 cases of measles. So 100 cases in 10 years in Ontario. And then in 2023 to 2024, there were 50 cases. So we're talking 50 cases in the last year. So that's like half of what the previous decade had seen. My apologies for my alarm. There seems to be a code red. I'll stay put here. In Alberta, we've been looking at a whooping cough outbreak for for the last 2 to 3 years. We now know that these numbers are in the thousands in terms of people getting whooping cough, and we've certainly seen hospitalizations of young children, especially babies, from whooping cough. And it tends to start in those areas where we have very poor vaccine coverage. So not only are we looking at significant drop in routine vaccine uptake and these new vaccine preventable diseases, and we're seeing a drop across the world. So newcomers may be coming from parts of the world where they have also experienced a significant drop. So they may not be protected. They're definitely coming into an area all over of Canada that does not have community protection to most to most vaccine preventable diseases. And they're also faced with a really complicated schedule across Canada, lack of our national registry for vaccinations, and new products. So, just to give you an example, just in earlier this year in 2024, Health Canada approved a new vaccine, an RSV vaccine for pregnant people to protect the baby during the first few months of life. So there's a new vaccine that's being authorized in Canada and potentially introduced across Canada. And then there's also another other types of immunization products. So there's the vaccine, but now we're also talking monoclonal antibodies. So nirsevimab is a monoclonal antibody that can be given to babies in the first few days of life to protect them against RSV disease. So new products that are available, new types of products that are available, and as a newcomer to Canada, you have no idea that the way things are purchased and negotiated is at the provincial and territorial level. So you're going to have difference in vaccine schedules and also what's available to you. So case in point, most recently, when you look at nirsevimab, which is this monoclonal antibody um, to be given to babies, it's not available across Canada. So, for example, Quebec and Ontario and the territories are including nirsevimab in their public health programs for their infants, but the rest of Canada is not. So you may be in Alberta where you don't have this product, and you may be in Ontario where this product is available to a baby. And in addition to that, in Ontario, the RSV vaccine during pregnancy is also public. It's also covered by public health, whereas in a province like BC or Alberta, that's only covered at personal cost. So really, uh, it's now this is an area of a very fertile ground for concerns and questions, and it's a complicated space, the immunization space currently. In a lot of ways, it's complicated in a good way, that new products are always a good thing, and the more disease we can protect against, the better. But you can see how this is complicated even for people whose English may be their first language, and to understand difference of products and difference of schedules across Canada. So, what does it all mean? So, we know that newcomers are at increased risk of vaccine preventable diseases. They have lower rates of routine childhood vaccinations. So, they may have different needs when it comes to immunization. The environment we're in does not offer community protection for most of our communities. And whereas I believe that this is applicable to current routine vaccinations, we need to think ahead in terms of new vaccination products and also what this does to newcomer needs and also confidence in vaccines, trying to think long term. So I'll share with you some of the work that we have done in Alberta to try and understand some of the immunization needs of newcomers. And I tell you this though, even though sitting here presenting this to you, I'm definitely not the boots on the ground for these projects. I've been involved with the projects, but these are done by a great team, and a lot of work that I'm presenting to you is done by the Praxis Health, called 19, used to be called 19 to 0 team as well, around this in this field. So this is work that was done by Praxis team, and then they published it in 2023. And they thought, well, can we understand the newcomer immunization attitudes? And to do that, so this is all done in Alberta. They did 90-minute focus groups, virtual and in person. This was mostly done in 2022. They did it in English, but they also did it in first languages. An example is Tagalog. They recruited through community partners, so they make sure they had the right people at the table when it came to understanding this. And and they looked at people who had come to Canada in the last 5 years. And then they did use thematic analysis of the transcripts. So they did 11 focus groups, 80 participants, and 13 countries of origin. And this is what they learned. They learned that parents typically, if newcomer parents, understand the importance of childhood vaccination, and they're generally pretty motivated to vaccinate their children in Canada. They generally trust the science of vaccination, and they trust that the healthcare providers and medical system is there to support them. So these are all very powerful and important indicators, because when you look across vaccine hesitancy and confidence across the population, trust is incredibly important, especially in the healthcare system, medical system, and motivation to be vaccinated is also very important. So these are obviously key facilitators to actual change, to actual behavior of vaccination. But they also identified the parents still had questions and concerns around vaccination. And Because they were newly come, they turned to their friends and family as a trusted source of information and decision making, because that was their peer of influence and that was their support group, which is again not that different even among the non newcomers to Canada. Friends and family we know are important trusted sources. But that is important to think about because it means that community influence. So, this idea of influencing communities, which will then influence individual behavior, is real key to maintaining community protection long term. And if they were going to, and the one important barrier that seemed to come up was that parents wanted, they found it difficult to access vaccination and they wanted more support in place. Um, Specifically, they found it particularly difficult to access a family physician. Now, what's interesting is in Alberta, family physicians, especially this year, for example, don't actually have the opportunity to provide any vaccinations. But when you think of provinces like Ontario, where a lot of the vaccination are provided by family physicians, that difficulty in accessing a family physician takes a whole new meaning when it comes to vaccination uptake. And they also found there was a lack of available vaccine appointments, and they struggled with the immunization booking portal. This was in 2022, and I can tell you that since then, that portal has changed. Public Health has done a fantastic job of trying to make this way more accessible and easier to book multiple children appointments all together. Before you had to book like separate appointments for every child. Um, but this was a big barrier at the time for people. And then also lack of available transportation to attend the vaccination appointments. Now, not all public health centers are on easy transit access, so lack of available transportation was a key barrier. And then the really big thing that came out of it is that parents needed translators and translation services. First, during the actual appointment booking process, but then also while at the public health clinic. So, through this whole kind of process of booking and then taking your child there, they needed that support. And there seemed to be a particularly lack of understanding of the school based vaccination program and consent. And there was no in their first languages. And they were also confused about the inconsistent schedules. And or so it seemed to them. And there was a lack of what they would identify as reputable vaccine information provided in their in first languages. And language barriers while looking for information and asking questions around specific vaccines. So that support of language support in their primary in the first language was key to newcomer families. And I tell you, I'm a newcomer to Canada, but when we came was I had been a newcomer to Canada about 2 decades ago, and I distinctly remember that my vaccine record did not we didn't have all the records and did not quite uh, align with the Alberta schedule. And I remember distinctly my parents looking through the consent form, and I'm now looking back convinced they had no idea what they were actually saying yes to. But I'm also not sure they understood that there was even a choice because so there's not just the language barrier but also the cultural barrier. So some of the places people come from may have mandatory vaccination, so they may not even understand that there is a choice around vaccination in the place where they're at in Canada. And then they they took these thematic analyses, so they looked at these themes that came up and put it together in my absolute all-time favorite behavioral change model, which is the COMB model. And this base is based on capability. So the idea of saying, well, in the context, what are the knowledge and skills that people have to engage in a behavior, and then opportunity, as in what are the external factors that make this behavior possible. So, physical opportunities, such as getting into the vaccination appointment via transportation, are all valid points of opportunity. Also, time. Can you take time off of work to go to the appointment? Can you book all your children together in the same time and same appointment. And then the other important aspect of this is motivation, and that refers to these internal processes that influence decision making. And in the COM-B model, they talk about reflective motivation. That's the reflective process you think about when you make a plan. And then the automatic one, which is about impulses and inhibition. So, this idea that a desired behavior, you want to turn the desired behavior from something one needs to do into something one wants to do. So, this is what the COM-B model is helpful at. So, then you take your themes and you map them to the COM-B model so you can come up with some actionable recommendations at the end. And this is what the work that was done from these focus groups looked like at the end when you map it onto the COM-B model. So there seemed to be a lack of family physicians and the opportunity, lack of transportation, lack of vaccine appointments, lack of translation materials, record sharing, follow up, lack of childcare. And there were some things that were clearly motivational. So religious beliefs, unpleasant interactions with a healthcare provider, partners did not believe in vaccines. So, in the newcomer population, as in a lot of childhood vaccinations, mothers tend to be the drivers of the decision, but sometimes it's important to, in some cultures, a partner may actually weigh more than in others. And then capability as well, so inability to communicate in English. They didn't have the driving skills or the ability to get places. And then you have a set of barriers that kind of meet in the middle. So these are the things like cost of transportation, appointments during work hours, um, and trying to have good information around all these about appointments, about schedule, about public health system, about the healthcare card, about side effects. So these are trusting um, information that were identified as barriers. So these findings suggest that there's an opportunity to increase routine childhood vaccinations among newcomer families who are already pretty motivated to vaccinate their children, but lack the capability or opportunity to do so. So there seemed to be that a lot of the need was within this idea of capability and opportunity. So then we thought, well, what of this could be used and what is within our locus of control, and what can we do to maybe help within this area of capability and opportunity. And I'm pleased to share with you work that was done by Dr. Siobhan Wong. She's a pediatric resident working at the Alberta Children's Hospital, and she's done a lot of this work and recently just published it as in 2 days ago around this work. So she used a nominal, and again, this is in conjunction with the Praxis Health group, but use the nominal group technique to identify the barriers and to develop these interventions. And then they looked at, so they had these groups of newcomer families, and they said, okay, what are the main barriers? And then can you rank the barriers in what is most important to you, and then rank them around feasibility. And then they focused on school-based vaccination infographics and said, okay, well, let's talk about the school-based vaccines. So obviously, this is just a very small, drop in the bucket of issues that are here, but it's an example of how maybe we can use. You can use some of these techniques for other vaccination implementations. And then they built these infographics and then they actually had a first language focus group to get feedback on the infographics, and that was done in Arabic, and then that fed back into the development of the infographic. So they had like a market testing group as well. So these were the barriers that newcomers identified. So they said, okay, there are difficulty navigating the appointment system, difficulty with transportation, like I highlighted with you before, language barriers, but also there were some concerns about rise in anti-vaccine rhetoric and conspiracy theories, and then the issue with the family doctor. So then we said, okay, well, what of these could be ranked? So with the feasibility lens. How can we, what could be achieved via this project with this group? And then they ranked it as the top being increasing access to reliable vaccine information, development of vaccine equivalency tables to facilitate vaccine record keeping, and then increasing vaccine appointments availability and facilitating easier booking, and then championing the role of the family physician, and then streamlining vaccine record tracking. So then they focused on the knowledge gap of saying, okay, can we address the school age vaccine issues? Now, in Alberta, school age children in grade 6 received the hepatitis B. We're still in a catch up for that, I believe, 2026, and the human papillomavirus vaccine. And then in grade 9, they get the quadrivalent meningococcal vaccine and the diphtheria tetanus cellular pertussis booster. And then they built infographic sheets translated into 9 different languages. So to give you an example, my apologies, to give you an example, this is an infographic on the meningococcal vaccination. This one's in English, but they actually had this in 12 languages as well. This was again informed by these focus groups. And then they could build their different vaccines about different school age vaccines and the infographics in different languages. And then they pilot tested during a first language focus group with a small group of newcomers' parents. And these are the Arabic speaking, provided feedback, and they incorporated that into the final version of the resources. And again, this was a way of saying, well, can we make this more accessible and inclusive to members of society who may not traditionally participate in research activities due to language barriers? And in the publication, there's also this, and I apologize, I thought I had the publication right on the bottom, and I don't, and I am embarrassed about that, but I'm happy to send that in the reviewed slides for it. But so then they said, okay, well, here are the things that we can do. We can increase access to reliable vaccine information, and then they put suggestions and implementation on how to do each of those, and ensure the vaccine information is available in different languages, and again, recommendations for implementation in that, increasing vaccine appointment availability. Um, and an example of this, for example, is utilizing physician trainees to host vaccine drives, so community organizations, or utilizing community pharmacists around routine childhood vaccines, and then championing the family physicians. Now, this is obviously very difficult and not necessarily within the locus of control of most groups, but maybe expanding the role of allied health providers might help with that as well when you think of vaccine counseling and administration. So these are these identified and ranked needs by the newcomer groups with suggestions for implementation. So that's mostly focusing on opportunity and on capability. So ability as in, helping with the language, and opportunity as in helping with vaccination, appointments and transportation and so on, which, this is all part of access. Access is so important to newcomer families. But what about confidence and communication? So what about vaccine confidence in such groups? We know that vaccine confidence has dropped across board in Canada, as I showed you earlier. But what does it actually mean around newcomer families? And I tell you, this is an area that is exciting because it's up and coming, and we're seeing some work done within this field. But I certainly don't have very large studies to share with you and large findings. But I'll tell you a little bit about what we know. So I'll tell you, this is from the latest Angus Reid Institute. Almost now a year ago, they looked at post-pandemic coverage and attitude. So I told you that we've had this significant drop in backslide in childhood immunization. But here's what's really scary is that when you look at vaccine hesitancy and vaccine resistance, or people who are vaccine refusers, those numbers have really significantly increased. So pre-pandemic in 2019, 4% of parents said they were really against vaccinating their children. By 2024, 17. So that had increased fourfold. And then when you look at that I'm not sure, the gray bar here, in 2019 it was 8%, that doubled in 2024. They were just not sure about how they felt about vaccinating children. So these are the so-called maybe the vaccine hesitant. So we've seen a significant increase in vaccine hesitancy, about threefold, if you're going to include the vaccine refusers in the group. And what we also have learned since the pandemic is that timing is everything, regarding both the personal moment and the historical moment when it comes to making a decision about vaccination. So, where people are in their own personal life at that time and where they're seeing themselves in terms of the threat of vaccine preventable disease historically in the community, in the society, is really crucial to vaccine uptake behavior. Um, But what's also interesting is that when you think about motivation, um, personal protection. So this idea, I'm going to get vaccinated because I want to protect myself and my family is very important. But we also know that that's not true across all types of cultures and communities. So for example, when we were doing work around the pandemic, we knew that around COVID vaccines, personal protection was really the key driver of most vaccination among most groups. But a lot of the indigenous communities had this idea of collective responsibility. So they wanted to get a vaccine because they wanted to protect the elders and other people in the community. And that was actually the driving factor for a lot of those communities. So you can imagine that if you understand that the motivation is different within each community, you can change your messaging and you can change how the people on the ground communicate that information to that population. And really, the crux of vaccine hesitancy, if you're going to put vaccine hesitancy into one sentence, it's this idea of distrustful complacency. As in, I'm not totally sure I trust the vaccine, the healthcare system, the providers, and I'm very complacent about the disease. As in, I don't think I'm at a huge risk of this vaccine preventable disease. And if you think about influenza, influenza is the poster child for this because people say, well, I'm not sure. I get the flu vaccine and then I get the flu, which is a common misnomer and a myth that we often talk about. So there's this sense that I don't really trust the vaccine. And I don't get very sick when I get influenza, which is again a misnomer. Um, but that's a perfect example of how this distrustful complacency, this low concern about the disease, and low trust in the vaccine is really the crux of vaccine hesitancy. Now, when we look at um, when you look at newcomers, then we know that a lot of the vaccine hesitancy seem to be around the COVID vaccine. So when you look in here, a lot of this, where partners now believe in vaccines, unpleasant interactions, and religious beliefs, could have been applied to a variety of vaccines. But when you really got down to it, the COVID vaccine seemed to be the biggest driver of vaccine hesitancy. Now, what's really interesting is that to me, the little but important work that's being done in this field does seem to mirror the other general principles in society of why people are vaccine hesitant. So, for example, I was again at the Canadian Immunization Conference and I saw a great poster by Christian Hines from Dr. Ezezika's group, and they're from the Global Health and Innovation Lab in Ontario. They've done a scoping review looking at vaccine hesitancy among African immigrants. And the drivers of vaccine hesitancy were concerns about safety, fear of side effects, mistrust in healthcare system, and misinformation from digital media. So again, these are the same types of reasons why people declare they're vaccine hesitant, even among non-newcomer families. And so in some ways, it's helpful to know that the main drivers of hesitancy are similar. Now, what it's probably different is what are the mitigators? So, what can we do? Like, okay, so we understand the hesitancy. What can we do to actually increase uptake? And this is where access is very important. So, this idea that can we, if we improve the appointment times, the ability to book many of your children at the same time, the ability to get to that appointment, that's probably the biggest facilitator of vaccine uptake among newcomer families. But there's also a lot of trust and influence and commonality that I think we need to work on to prevent the erosion of vaccine confidence in the future. And again, when we look at from the same work from the African immigrant scoping review, the mitigators of vaccine uptake were culturally and linguistically appropriate information and trusted people. So that was community leaders, community peers, and healthcare providers whom they trusted. And the interesting thing about this whole, to me, like this is just the one thing that's been so consistent before the pandemic, during the pandemic, post the pandemic, among a variety of groups is that healthcare workers are still the most trusted source of vaccine information. So I'm going to give you a second to think about that because it means that we as healthcare providers have such amazing power and support to families, including uh, including newcomer families. So, for example, work done from immigrant mothers has shown that they learned about vaccine practices. Everything they learned was exclusively from healthcare practitioners during scheduled visits. So, even in places like Alberta, where family physicians don't give any vaccines anymore, as of this year, for example, um, they still have the advocacy, the education they can do with families is still a big driver of vaccine uptake and changing vaccine attitudes. So, when you think about trust and access, I know we talked a lot about access. I just want to spend a bit of time on trust. So, we know that um, we've done some work in the past with health brokers, and I know that again at the same immunization conference, we saw some work done actually from Calgary with international medical graduates who were doing work in the communities around vaccine uptake. So the boots on the ground people of vaccine influence and vaccine uptake for communities of newcomers were people that these communities and these members of the communities could actually find commonality with. And not only did they have that understanding of the language and culture, but they also had some lived experience that was similar. And that makes a big difference to building trust. And then I also really firmly believe, as having lived through, a family of newcomers myself and having gone to school in Canada, like to primary school, education in schools is so important in how it shapes your attitude and your take in this new country that you may come to. And if we can get vaccine and immunization information, education in schools, then I think then we're really thinking of the future and we're really thinking about how to teach our children to protect themselves in the future with this because they're going to be able to critically think, they're going to be able and then they will learn the information from trusted sources to begin with before they can be influenced from the disinformation and misinformation that comes at us via the anti-vaccine movement. So, how do we leverage this at the public health level? I think we need to pass messaging that establishes vaccination as the norm and as one of the many ways that we support health. So, when we talk about newcomer family and their health overall, there are many aspects of it. We need to think of socio and economic drivers of their health. We need to think of diet as their health. We need to think of access. And then, as part of that, we need to think of immunization against vaccine preventable diseases. So it's the norm, but it's packaged in the form of overall health. Um, and this idea of distrustful complacency is very important. So I say if you are working with newcomer communities, if you are a newcomer yourself or you speak a language other than English and French in Canada, then when you speak to groups, focus on the disease. So instead of spending your time trying to combat vaccine issues, so issues around is it safe? Is the vaccine going to work? Focus on people understanding what this disease may mean to them because I think there's so much misinformation around what influenza is. People still mix up flu with the stomach flu. So they still don't understand that influenza is very different than that. People still mix up measles with German measles. Very different diseases. One is rubella, hardly causes any problem to a child. It does to an unborn child, but not to a a 2-year old versus measles, which is a significant impact on younger children. Same thing with RSV, pneumococcus, and chickenpox is a disease of temperate climates. So if you have a family coming from tropical climates, they may have no idea about chickenpox, and they have no idea they actually are very unlikely to have had any protection against this as children because they won't have been exposed to it. So focus on the disease, on this idea of distrustful complacency, and help people understand they shouldn't be complacent around these vaccine preventable diseases. Um, and as healthcare providers, other than the same principles of communication, there are a few other things that we can focus on, which is a positive interaction with each healthcare visit. So, as healthcare providers are, sorry, as newcomers have uh, contact with the healthcare system, every positive interaction is going to help build trust in the healthcare system and increase opportunity to vaccinate with each interaction. A recommendation from the healthcare provider is still the most trusted source of vaccine uptake and basic translation of materials. We just covered this, but I also want to show to you just a few things that we have developed. Now, this is not with newcomers in mind, and I would love to be able to take this specifically to newcomers, but a lot of the vaccine confidence and hesitancy issues are similar, and I still think this is a very helpful kit to think about if you're a healthcare provider. So we developed the Vaccine Confidence Toolkit. It's available on our Department of Pediatrics website. And we've built, and then we're targeting pediatric patients, patients who are pregnant or patients with immunocompromised. And then if you pick, for example, pediatric patients, then you get a number of what they're the virtual simulation games. So these are games on talk to uh, um, uh, how to talk to families around and how to advocate for vaccines. We've most recently done one on RSV immunization. I would love to be able to do one in the future specifically for newcomer families. I think that'd be so helpful so that people understand the cultural aspect of and a lot of the cultural trauma that newcomers might have experienced around vaccines. But overall, here's what my quick approach to how to communicate. Before you communicate around vaccines, you have to have some kind of connection. If you don't have connection with that family in any way, then that's going to be almost a non-existent conversation. And in that case, just focus on building a positive interaction with the family. But if you feel like you have some connection with them, it might be a lived experience, it might be a similar medical trauma, it might be the same language, then you have a connection, then highlight that connection before you communicate on vaccines. And we have to show true curiosity. We have to truly understand with where each patient is at before we can address that vaccine concern. And whereas you can't always validate the concern, you can always validate the emotion behind the concern. So, you cannot validate that HPV vaccine is going to make people more sexually promiscuous, but you can validate the emotion, the fear that their children may have a different experience with sexuality. That's a very different emotion. Validate the emotion is very different than validate the concern. And at the end of the day, keep it very personal. Focus on the disease and what that means to that patient and that family. Stay away from any philosophical debates around vaccinations as a whole. And to help you with that, I also have this Protect framework, which is a mnemonic. I'll include that in the slides if people are interested in using it. But it's the same idea of how to. It's a communication framework. Um, so take home points. Newcomers are at risk of being underimmunized and more prone to vaccine preventable diseases. Access is really the crux of the problem. Physical access, lack of family physicians, language and cultural barriers. And we need to think ahead. How do we empower those vaccine champions within communities? Aim for that peer community influence to lead to that community protection. And before you communicate, connect. Otherwise, it's not going to have the same impact that you think it might. It's not about correcting misinformation, it's about building a connection. I just want to say thank you to the people who've done a lot of the work in this field here in Calgary: Siobhan Wong, Margaret Fullerton, Emily Doucette, and the Praxis Health team. This is my email. And last slide is I'd love to welcome you all and invite you to the BAMF Pediatric Infectious Disease Conference early in February of this year. We'll cover some amazing immunization topics. It's focused on pediatric and family medicine providers. So it's a very pragmatic conference around advocating for children's infectious disease and immunization. Thank you.
Thank you so much, Cora, for that informative presentation. And we have lots of questions coming in, so we'll make time for those. And I will remind the audience that if there are any questions that we don't get to today, we will share those with Cora and we can answer those after our presentation. So with that, we'll dive into our questions. And thank you to the audience for upvoting. We'll jump into this question first. So obviously this is a parent. They said their family doesn't have a family doctor, and how can they get a vaccine record or certificate for their child? Can we access something online to get their children's vaccine record?
Yeah, so it depends where you are, unfortunately, in Canada. So in Alberta, you can go to a walk-in clinic, you can go to public health, and everybody has access to the vaccine record and they can provide you a printed record. But in every other province, it's different, unfortunately. And it's very hard to get a vaccine record if you do not have some kind of connection to the healthcare system. Now, in some places, centers for newcomers will provide that, as well as refugee clinics will help with that and will help with aligning schedules to whatever the province schedule is. But it's not a systematic, uh, standardized approach across Canada. The Can Immunize app is an app that you can also download. It's free of cost to the end user. And then you could enter your own vaccine records in there, and they can even provide you um, reminders for your children. Used to have it for my kids before we had a really nice immunization record in Alberta. And that's just something you can do. It's called Can Immunize, and it's available to download both Android and Apple, and you can at least you can start to build an immunization record that way with your family.
Fantastic. Thank you, Cora. And just to add to that, it looks like someone has shared a link in our Q&A, which is great to get them started. But if the parent, they know that their child, they're aware that they've had some vaccines, what should they do in that situation? They know, but they don't have a record.
That's also really difficult because as a whole, so it's really, I believe in most places, public health will only recognize vaccines if you actually have a record. Um, and the reason for that makes good sense is that whenever we've done any work on how well parents think they remember what the children have had, they don't. It's easy to get it mixed up. It's easy to get mixed up with one child or the other. So it's really only recognized if you have some kind of record, which is very helpful. Public health is very, very good at knowing what other vaccines are called across the world. But I also want to tell you that most of these vaccines are safe to give an extra dose of. So don't be afraid of saying, well, I can't remember if my child had a measles, mumps, rubella, varicella dose before. Just get a dose when you're in Canada, because it's much more important to be protected than to worry about extra dosing. Most of these vaccines are very safe and I shouldn't say that all these vaccines are safe, but most of them we actually have data that say that multiple doses are safe to give.
Okay. And Cora, what do you think like some of the main hesitations are for vaccine hesitancy? Like what do you feel are the main reasons for that?
So I could talk for hours, which I
Hours.
know you won't let me on this, but I'll tell you this: if you ask people what they're worried about, they'll always say it's side effects, it's
Mm,
worry about the vaccine. Um, what's really interesting is this double exceptionalism. So people feel that their children are so special. I've got three of those, so I totally get it. They're so special that um, the some awful side effect is going to happen to their children. They,
Mhm,
millions of other children have had it, but their kids are different, and that
mhm.
does that is a strong, motivator for vaccine hesitancy. I would say the other big thing is people ask their friends and family, and then that's how we parents make decisions. We ask our other parents, "Hey, what do you think about this?" And that's how they make decisions. But if you're actually going to see what changes behavior around vaccine hesitancy, is seeing their child at threat of the disease.
Okay.
So it doesn't matter what they think about the vaccine. If they feel their child is threatened by measles, then they're going to go ahead and immunize, which is why I say combat complacency. So when you talk to your friends and when you talk to other, talk about the disease and what that means to their children.
Thank you so much, Cora. We have so many questions, and it's like we've scripted this. You're leading from one question into the next, and you were chatting about that misinformation. So, how can we ensure vaccine misinformation is prevented, especially to newcomers that may rely on less reliable sources, something like WhatsApp?
Yeah, so I'm so glad you said WhatsApp. It's so popular
Mhm,
among newcomers, and that's exactly what we need to do. We need to figure
mhm,
out how they get their information, and then we need to find trusted people that they trust, whether that's their religious leader, whether that's their, community group. We need to find those channels and we have to use them. So there's no point in me talking on the CBC about vaccines if
mhm.
newcomers never tune into that. That's not going to, and they also will never relate to me because that's not who. So we need to find the people who they trust, their peers, and we need to use those, I keep on saying this, boots on the ground people. We need to use people within communities because that's who newcomers trust. They trust their community naturally. We all do,
Of
but they
course.
maybe migrate to the community faster than others because of that. So this idea of community influence is so important and we need everybody's help for that. And this is why if you're at over the holidays and you're talking to your community of friends, share why you are immunizing your children because that goes a long way to trust and to this community influence idea.
Absolutely. And that was a key theme in your presentation, Cora. So I think that's a great place for us to end on our questions today. It went by so quickly, but I do want to thank you for taking time to participate in today's presentation and giving this to our members. And obviously, I'm going to give a big thanks to our audience for spending time with us, engaging with us, asking all those great questions. And we hope to see you at upcoming events, which we have up on our screen. Um, as we mentioned earlier, if you missed any of today's presentation and would like to watch the session again, we will post the recording on the N4 platform within the next week. And we want to continue this dialogue. The presentation has started, so please continue to do that in meeting place. And then we also have some curated resources that you can take a look at. So if you haven't yet, please sign up to newcomernavigation.ca for all the resources and learning opportunities. Following today's session, you will be invited to complete a survey and share your feedback with N4. These surveys are valuable. Please take the time, just a few questions to get through, and they help us develop topics and themes for our upcoming webinars. So we kindly ask that you do that. So the next upcoming webinar will be in January. We have our mobile app, so please check that out, Apple and Android devices. You can look at that through our QR code here or by going to newcomernavigation.ca/iOS or Android. Thank you again. We greatly appreciate you joining us. And our last words will come from Cora. So I'll hand it back to you.
Thank you, everyone. And I will include the Praxis Health infographics link, and then I will also include the publication in terms of the link there. And then I'll also put a link to our vaccine confidence toolkit. So thank you all for joining. I really appreciate that and for
Thank
your
you,
great
Cora.
questions.
Greatly appreciate it and wishing everyone happy holidays. We'll see everyone in the new year, January 29th. next webinar. Thanks so much. Have a lovely afternoon.